Lauren Payne. I am the co-founder of Clinic Concierge and also the Chief Brand Officer. Welcome to the Clinic Concierge Collective. This is a podcast where we will bring you a collection of curated conversations with the experts. So today I have one of our very own Dr. Charles Roberts with us. He is one of our supervising physicians here at Clinic Concierge, and he specializes in longevity medicine. So we're going to have a lot to talk about. I'm so glad you're here.
Happy to be here.
So let's get right to it. I want to jump into the burning question of 2025. And that is, how are you helping your patients to lose weight in this year?
This is a very broad question, and I will try to keep it big topic.
Ramble, but we're going to help.
Yes. I like to go down rabbit holes and do deep dives on things. But
wait, hold on. Before we get started,
sure.
There's one more thing. What I want to do with all of my guests is have them bring one of their favorite healthy beverages, and that's going to be our little icebreaker. So
Sure.
What did you bring for us today?
I brought a matcha latte.
Cheers.
Cheers.
Why do you love matcha lattes?
I think it's a good alternative to coffee if you don't want coffee. Matcha is has a lot of antioxidants, healthy for you in that way. I think slightly less caffeine content than coffee, but don't quote me on that because I'm not 100% sure. But I like to think it is.
It's really good. It's warm, it's creamy, and it's healthy. So we'll be sipping on this in our conversation. Okay, so back to the topic. Weight loss. What's a easy fix for 2025? What are some things that we can do to promote weight loss for all of our patients?
So I think when it comes to weight loss, I think people generally tend to overcomplicate it, to be honest. I think everybody's trying to find that like perfect diet or, that like one thing that's going to kind of fix everything. And it's really a combination of things. I mean, I think everybody knows, and the more we learn in medicine, everything's a multifactorial process. So just baseline, getting good, consistent sleep, honestly, helps a lot. It just helps your body regulate its own processes and will help you lose weight. It's been shown that people who, don't get as much sleep don't lose weight as easily. Getting good nutrition, and again, doesn't have to be some sort of crazy diet. Just tell all my patients, emphasize whole foods. Make sure that you're getting a good amount of protein, 1 gram of protein per pound of desired body weight per day. Then obviously exercise being another major component. Those 3 things, just foundation of good health regardless. Like you should be doing that, and having that good foundation will ultimately help you lose weight. And then, always being in a calorie deficit. Yes, there are nuances to everything, and eating more nutritious foods and is going to be better than, eating a lot of processed foods, and the way that your body responds to those will, is different. So that's why a lot of processed foods are not as satiating. So people do fill up on empty calories. And then with things like protein, it's more satiating. So if you eat more protein, you're going to feel more full sooner. So you'll ultimately be in a calorie deficit because you're not eating as much food because you don't feel like you need to.
So, okay, on that topic, say our patient weighs 120 pounds. It's 120 grams of protein, right?
Yes.
Quite a bit to get to. What does that look like on a plate or in a day?
Yeah, it's difficult for people to get to, but that is a good rule of thumb, and I think people should always try to get that. Nobody should beat themselves up over it if they don't get to that. But I think the easiest way to at least increase your protein intake is, have 1, maybe 2 protein shakes a day that do have a fairly significant amount of protein.
Do you have a favorite protein shake?
Yes, I do. Personally, it's marketed more as a meal replacement, but it still has 27 grams of protein in it. So I use that powder, and it's called Health Code.
Okay.
And
anyways, sponsored by.
I am not sponsored by it. It was created by this metabolic scientist in Utah who has his PhD and focuses a lot on metabolic health and metabolic syndrome. And I respect his work a lot, and I think he spent a lot of time kind of putting everything that somebody would need in this powder to genuinely make it a meal replacement if you want to use it that way. I use it more as honestly a weight gainer, because that is my issue, is not gaining weight as easily as I would like to. But I know several people who use it as a meal replacement, and it's 400 calories per serving, but they will feel full for hours after drinking it because of the protein content and because of all the other things that it has in it.
Okay, you mentioned about calorie deficit. That sounds a little scary. What does that mean?
So calorie deficit just means consuming less calories than you're expending.
Okay.
So there are many ways to do that. One of them, which I already touched upon, is when people don't, again, emphasize protein as much as I think that they should, which is why I really do try to emphasize it and do that 1 gram per pound of weight per day. And again, repeating myself a little bit, but protein is just more satiating. So
Yeah.
the more satiating foods that you eat, the fuller you're going to be, or I guess the more you're going to be satiated earlier on than you normally would be in your course of the meal or whatever. And then just that's consequently going to make most people eat less calories than they normally would because they feel full. One of the other ways to do that is very popular, I know, is intermittent fasting or time restricted feeding, or whichever term you want to use. But setting an eating hour window where, if a very common one is somebody breaks their fast at noon and they stop eating by 8 p.m. And then from 8 p.m. until noon the following day, they're not eating. And so if you are...
It's like an 8-hour window to eat, to consume calories, to fill up with protein, and then resting.
Yep.
Consumption.
Yes.
Okay.
And
it's a long time.
It is a long time, but a lot of that you're sleeping. And on that note, I do think it's good. Like, eating right before bed is like never a great thing to do anyway. So I think having a cutoff at like 7 or 8 kind of forces you to eat a little bit earlier and forces you to have that time in between finishing your meal and going to sleep. That's just good for you, your health in general. But because you are limiting the amount of time that you're eating food, again, by and large, most people are going to eat fewer calories because they have less time to eat. So those are kind of like two of the big ways that is a, I guess, two big ways that people can get a calorie deficit.
Awesome. I know there's a lot of usage and discussion around the GLP-1. So can we touch on that subject a little bit? Are you prescribing that? And are you a fan of it? And if you can, break it down into like very simplified terms. What is it? What are people injecting? What are they using?
Sure. I am prescribing them. I think that they're great. I think that it is a very useful tool to help people lose weight. In a very broad sense, the GLP-1 drugs are in the category of drugs called peptide drugs. So to throw it back to high school biology for just a really quick second, we have our 20 amino acids in our body. When you have a chain of amino acids, it can be a peptide if it's less than 50. If it's more than 50, it's considered a polypeptide. And then one or more polypeptide is a protein. So just basically that's all I wanted to touch on, is just to know where it came from and what it actually is. So it is just a chain of amino acids, your GLP-1, that stands for glucagon-like peptide. So it is a peptide that binds to a receptor in our bodies and it sends a signal to our brain. Well, it has many different receptors that do many different signals, but for our purposes that we're talking about, it basically sends a signal to our brain that we are full. It also helps delay with gastric emptying, which causes stretch receptors on the stomach to send another message to your brain saying, hey, I'm full. I don't, need to eat anymore. And then there's multiple other mechanisms that kind of play out from that. But yes.
So is this something that once you get started on, would you expect to be on it forever? And is that safe to be on it forever? Or is it something that you can take for a little bit of time? How does that work? I think people are sometimes nervous to get on these things because they don't want to become dependent on this way of losing weight or keeping weight off. So how, I guess, would you answer a patient's question about that?
So I think this is kind of where I like to kind of get into the details and customizing it to the patient themselves. I think we're starting to enter this era of knowing a lot more about how each individual works, and there are nuances to every single person, and there's no one size fits all when it comes to medicine for that. And so I think that you can go either way. I like to talk to my patients kind of with the assumption that we will ultimately taper them off, because I'm just of the opinion that if you don't need to take something, why take it? But if you need to stay on it long term to help you maintain a good weight, um, we 100% know what happens from being overweight for extended periods of time: metabolic syndrome, diabetes, high blood pressure. So I think the risks of that and versus taking it and staying at a healthier weight and not developing those in the first place, I think that is a far healthier option. When it comes to potential risks, side effects, staying on it long term, it does seem to be incredibly safe. We have a lot of data about how they work in the type 2 diabetic, obese population. And in that population, it seems that it's been very safe. And then in the more recent years, since it's been approved for just weight loss, we are studying it now more in this newer population where they don't have any of those other comorbidities, but it's just weight loss. And we have a good 5+ years of data on that, and it seems to still be really safe.
Yeah. So on that note about the other side effects or ways, things that we're treating patients for and those potential side effects, I know there's now kind of like two types of the semaglutide or GLP-1s, tirzepatide, semaglutide. What's like the main difference between those two? I think we have the population has confusion or misunderstanding on all these different types of injections.
Yeah, so semaglutide, you can think of, I think, two categories. So semaglutide is going to be your Ozempic and your Wegovy, and then your tirzepatide is going to be like your Mounjaro and your Zepbound. I believe that's right. And the difference between them is that semaglutide is just a GLP-1 agonist. Tirzepatide is a GLP-1 and a GIP agonist. So it has a second peptide in there. It's binding a different receptor. It's binding the GIP receptor, and it's eliciting its own responses and signals, and just kind of has an additional mechanism of action that your semaglutide doesn't.
Okay. So kind of like the newer, improved designer version of what was old and before.
You could kind of say that. Yeah, there's an added benefit, and I think the more we study it, the more we're kind of realizing that for the tirzepatide, there is increased cardiac health, and there's like a neuroprotective effect, and there's benefits bone health as well, actually.
So I think people need to remember it's not only just for weight loss. Of course, that's what's oftentimes why we're prescribing it or why people are on it, but there's so many other added benefits to it besides just the weight loss. So I think that's important for people to remember that too.
Yeah, and I think it's also, I mean, it's important to note that whether like the cardio effects, like the tirzepatide, it helps with the lipid profile. So is it directly cardioprotective, or is it more, there's some anti-inflammatory effects to it and it helps with your lipid metabolism? So is it helping your heart and cardiovascular health from that standpoint? I think there's still, more that needs to be understood, exactly the specific mechanisms on a molecular level, what's happening. But there are studies that have just been showing that, there are cardiac benefits. It is neuroprotective. And I think there's a lot when it comes to metabolic syndrome. There's so much interconnection between all of that stuff that I think it all just kind of works synergistically.
Yeah. Okay. That's really great. So another question about that medicine, it can be in the injection form or even in the pill oral form. So what would be the advantages of one over the other if somebody was choosing between injection versus pill form of it?
For the injection, the bioavailability of the drug is going to be higher. it's just going to work better. I know not everybody loves sticking a needle in themselves, once a week.
Pain, no gain, right?
Exactly.
No loss.
Yeah, that's yeah. No, that's better for this. And it is a really, really tiny needle, so it's not bad. It is like a Botox
If
needle.
you're okay with the needle being stuck in your face,
Yeah.
you can stick it in your tissue.
And you can even get someone to do it for you if you just really don't want to do it yourself. I've done that for my patients.
Well, of course, teach you how to make you comfortable. So just overall better absorption, just works better, faster, all the things.
Yeah.
The injection form. I do want to know, I think a lot of people are curious about GLP-1s and maybe have never tried it or heard horror stories about people who have tried it. So what would you say are the potential horrors or side effects? And what are some risks involved, or maybe some misconceptions of the risks?
So I think the biggest thing that people usually hear about is nausea. I think as long as you start at a low dose like you should and you titrate up your dose to what you need, the nausea is very minimal or not even there. Some people are more sensitive,
And that just probably requires a practitioner who knows what they're doing, prescribing, and really takes it individually and not just some cookie cutter approach, I would assume.
Yeah. I mean,
Describing it.
generally speaking, like the kind of general accepted practice that's, been put out there by the manufacturers is, you titrate up once every 4 weeks. So your first 4 weeks is one dose, then weeks 5 to 8 is a second dose, and you titrate up until it's being effective to you. But just like you said, and how we've talked about before, everybody's a little bit different. It's not like you always have to titrate up to the highest dose, because we're not talking about people who are needing kind of necessarily the max effects for their diabetes or whatever. So I think that is one thing that I know people hear about that they're worried about, but as long as it's done slowly, and yeah, you're, working with someone who you trust as well, and that you can contact them easily and be like, hey, like, this is how I'm feeling. Is this okay? I think you'll be fine. I know probably the big things that people hear about are the loss of muscle mass that people have experienced and the weight gain back after people are off of it. I think the answers are, I guess they kind of go together, but for gaining the weight when you go off of it, again, I'm not saying that everybody needs to go off of it, and I think it's safe to be on for long term. I have patients that have tapered off of it, and I have patients that have remained on it for long term. I think for as long as, if you ultimately want to taper off, making sure that you're doing all the things that we were already talking about, getting your adequate good sleep consistently, nutrition, exercise, and you're using this medication kind of as an adjunct to help you lose those last 10, 20 super stubborn pounds that just don't seem to want to come off. If you can do that, and then you can taper off of it and maintain that weight because you've already established those good, healthy habits, and that was all you needed, great. But if if that doesn't work for you, I think it's still ideal to maybe titrate down to a slightly lower dose if you can. But again, everybody's different, and doing what you need to do to keep it there and keep your healthy weight is what you need to do.
How do you prevent the loss of lean muscle mass? Or is that 100% certain thing for everybody who's on it?
Not at all. None of my patients have lost muscle mass. Most of them have actually increased, honestly, because I'm kind of I'm a hard ass when it comes to the GLP-1s, because that was such a thing that came out, is that in these studies, there was all this lean mass loss. And I think it's because, a lot of these studies were done in patient populations that were unhealthy. They were obese, they were unhealthy, but nothing really changed about their lifestyle. So sure, they were at a calorie deficit because they were eating less, because they felt full because of the medication. but they were eating less of the bad things that they were already eating. So if they had modified their lifestyles to exercising more with resistance and weight training and eating more protein and everything, they wouldn't have done that. And so that's what I emphasize with my patients. I'm like, you need to be getting 1 gram per pound of body weight per day, and you need to be doing resistance and weight training. And I have them get a DEXA scan once every like quarter, basically, to check in, at least, especially in the beginning when they are first on it and they're first losing weight. And I'm like, hey, we'll be doing this every 3-4 months, and checking in on your muscle mass and making sure that it is either at least staying where it is, but ideally increasing. And I have not had one patient yet lose muscle mass on it.
So probably an issue for the patients who just aren't, or who are just using it as a Band-Aid fix and not really changing anything else. And that's kind of why we saw those studies come out, because they didn't have good providers necessarily taking care of them and encouraging and promoting the other things to lose weight or to maintain a good health. Okay, well, I'm glad to know all that. And so I think our patients and, the population doesn't have to be as scared about these potential side effects. And so besides these injectables, which are just seeing really great results, really fast results, people are very happy with them, what are some other weight loss just methods or options or tips and tricks that you have as a longevity expert and just an overall health and wellness expert? Maybe some even simple things people can do without prescriptions or without on their own at home. What would you say would be some of your favorite tips on that?
I think probably kind of circling back to what I said about the protein and just emphasizing whole foods. Anything that is, not processed, it's just gonna make you feel fuller. Especially when it comes to the protein. It's gonna make you feel full, and you're not gonna feel like you need to eat, and ultimately you're gonna eat less calories. But from a nutrition standpoint, you might even be getting more nutrition based off of what your diet was before. So kind of anything to kind of like increase that satiety signaling that you're kind of supplementing with the GLP-1.
Do you have a favorite supplement, like over-the-counter supplement that just in general to take to promote overall health and wellness?
There's a few. What I was gonna mention was honestly taking fiber every day, like a Metamucil or Citracel or Psyllium husk or whichever one. Not only will it make you feel full, but there's so many well-documented benefits from a intestinal standpoint for your gut microbiome and like preventing colon cancer. So I think that's a really easy, cheap thing to do that not only will help you feel full and maybe eat less throughout the day, but also just be good for your digestive health overall. When it comes to other like overall health supplements that I like to take, I am a fan of AG1 Athletic Greens, formerly Athletic Greens.
Okay, not sponsored by AG1 in any way.
Not sponsored at all.
Could be.
I mean,
at some point.
I'm here.
I'm here
now. And I know we've talked about this before, but my kind of reason why I like it is, and with a lot of the other green powders, I just like AG1, is that, it's just a good way to kind of start out your day knowing that you have gotten a lot of the vitamins, minerals, that you need, that your body needs to just function effectively and efficiently. Like regardless of kind of how healthy you are or, whatever you are with your diet, I know that my diet is not, I'm healthy, but I'm not super varied in my diet. It's not like I'm eating like 20 different kinds of vegetables. I stick to like 5. So I know that there are things that I'm missing that I could probably get otherwise by, having more beets or whatever. That was just a random vegetable that popped into my mind that I don't eat frequently at all. But
they're hard to eat. They're hard to prepare. They're messy. They stink.
Yeah, I'm not going to do it.
I mean, I'll just go get a juice.
Exactly.
Take it that way.
But just, there's every vegetable, fruit, they all have their own benefits, and they all have their own, kind of thing that they're known for this vitamin, or they're high in antioxidants or whatever. And so the more diverse you can be in that kind of whole food diet, the better off you're going to be in general. But since I'm not like creative in the kitchen at all, and I stick to like the bare minimum of like not needing to work hard, like eggs and chicken and like my 5 vegetables,
Lots of protein.
And lots of protein. That's why I like AG1. And then I also do creatine every day. I think
That's kind of a trending word these days. Let's just pause. What is creatine?
so. Creatine is creatine monophosphate, and it's always been very popular in the muscle building, bodybuilding world. People think that it makes your muscles grow. It doesn't really do that.
Side note: I did take my creatine today. I'm feeling pretty swole.
As you should. You look it.
I did take it, but I'm not bulking up. Not yet.
So the creatine basically gives your body phosphate, and your body needs phosphate in order to create ATP, which is, again, throwing it back to high school biology. ATP is like the energy currency that all of your cells use in your body. So it basically makes it easier for your body to replenish the ATP that was used during your workouts or exercise or whatever. So you have more energy and your muscles have more ATP and whatever to do your next workout. And so that is how it builds muscle. It's not like a direct, like, I start taking creatine and I'm going to gain like 3 pounds of muscle. It's because of that effect, that
pathway of
yes.
reaction.
So
take that every day. Do you take it in a capsule or powder form?
Powder.
Okay,
just 5 grams.
Better absorption.
And it's
to your AG1.
I added to my AG1 just because then I just start drinking a lot of water and I'm peeing all day. And
so good.
I mean, it's good to stay hydrated. Don't get me wrong, but at some point you just are peeing too much and you're like, this is disruptive to my day.
My workflow is been ruined.
Exactly. But the other benefit that has been more recently gaining a lot of attention is the neuroprotective effects of it. And that's, I know a lot of women have always been worried about creatine and kind of exactly what you said, like hulking out or bulking up, or, they talk about how you increase water retention with creatine, but the water retention is actually kind of intracellular and in your muscle cells. So it's not like the same bloat that you would get if you, had a really high sodium diet or something and felt bloated afterwards. It's a little bit different. But the neuroprotective effects are, I think, why everybody should take it.
Like protecting from future Alzheimer's, dementia? To that degree?
Neurodegenerative diseases. Again, still not like entirely understood, but just kind of the studies that have come out recently have just been honing in on that there does seem to be some degree of neuroprotection.
Mm-hmm. That's interesting.
Yeah.
So AG1, creatine, increased protein, increased sleep. What about exercise?
Exercise should be a good mix. I think cross training is so important. You need to be doing resistance and weight training in addition to cardio training. Personally do, HIIT classes, and then I'll do yoga and I run. And so I feel like that kind of, and I mean, HIIT is my weightlifting, but I will also weightlift on my own. I just don't enjoy it as much personally.
Well, I don't think we ever announced or said to the audience, to our viewers, that you are a yogi expert with 200 hours of completed yoga training.
Yes, I'm also a yoga instructor, yes.
With a really awesome handstand.
I worked very hard on that, so I very much appreciate that.
We can make room in here later. We'll show our viewers that handstand.
Deal.
So cardio, like how many minutes, like if you're picking a number in a week or in a day multiplied by 7, what's the ideal number?
I think doing 3 to 4 resistance weight-based training workouts per week, and then 3 to 4 cardio-based trainings per week is a good mix. I think something that's being more emphasized, but I would still like for it to be even more emphasized, is resistance and weight training. I think it's kind of been overlooked when people talk about exercise. It's always been cardiovascular. You need to go for a walk, you need to go for a run. And while that's important, when looking at it from like a longevity standpoint of life, like muscle mass is like the most highly correlated thing to, how well you're going to live your life later in life. Because as we age, muscle mass is going to just naturally decrease. It just is. It's harder to put on muscle once you hit like 40. And yes.
Raising my hand. My neighbor I saw the other day walk out with what I thought was a bulletproof vest on.
Oh, rucking?
Turns out it's a weighted vest.
Yes.
What is that all about?
So that's and rucking is, again, kind of growing in popularity. I know Peter Attia talks about it a lot on his podcast. And it's walking for, several miles or however long you want with some sort of weighted vest, backpack, whatever. And that, it's good to build kind of that lower body muscle mass, which is so important. I can't remember the specific study, but the kind of what I was referencing earlier was that it was the like thigh muscle mass that had the like highest correlation to people's kind of longevity.
Interesting. Well, that's another thing we could add to our 2025.
Actually, it's on my 2025 list of things to start doing. Yeah. So rucking. Yeah.
UCKING.
Yep.
All right. Well, now you know.
The more you know, shooting star.
So, okay, well, this has been really just enlightening to what is happening in the world for weight loss these days. So I'm really glad that we could just kind of break it down to the basics, going back to biology. I'm assuming you were probably in AP biology back in the high school days.
I was.
So it seems like. So I'm really glad we have the expert here. We won't get into like your test scores and stuff on that, but I'm sure it was 5 out of 5, pretty close.
It was. I did well.
Okay, so part of the podcast, the beginning and end, what we like to end on is some of our 5 fast facts. And these are going to be the same fast facts that we ask every person in the hot seat here.
Okay.
So Dr. Roberts gets to be the first to go through these questions. So just real fast, morning or night? Are you a morning or night guy?
Morning.
Okay. Sweet or salty?
Salty.
Eating in or going out?
Eating in.
All right. And one bedtime routine that you'll never skip?
Huh. Ooh, I don't know.
Do you have a...
I wish I had a better bedtime routine.
Is it like that cup of chamomile tea or that 1 milligram of melatonin?
No, I don't. I mean, my bedtime routine, I do think it is good to have since you're bringing it up, it is good to have a bedtime routine, because if you're doing the same thing every day, it's, signaling to your body that, it's like time to start quieting down and for you to fall asleep. And I do think one thing that I did start doing that I do still do frequently is go outside and watch the sun actually set. So
long walks on the beach during sunset.
That's
your thing.
That is my thing. But just those last few minutes of daylight, when you can still see the light, but the sun's below the horizon, and it does send a signal to your brain, hey, it's getting dark, it's time to start going to sleep. And then brush my teeth, take out my contacts, everything else. Hopefully I read something. Well, I would never not take out my contacts. That's such a boring answer, though. That is such a boring answer. I would not brush my teeth before I would not take out my contacts. If I'm narrowing it down to one, if I had to choose, I would not brush my teeth before I would not take out my contacts.
Okay, good.
My mouth can survive not being brushed at night once. I could get a serious eye infection if I left my contacts in and slept with them.
Deal with that. Okay, and then I know we kind of touched on exercise, but your favorite form of exercise, what would be, if you could only do one form of exercise for the rest of your life, what would it be?
Yoga. Yeah. It helps me both physically and mentally. So I definitely like the mental aspect of it, kind of the meditative aspect of it.
Do you prefer hot or room temperature yoga? Hot yoga. Just sweat it all out.
Yeah.
Yep. And last question. So I want to end all of our conversations on a note of gratitude and just leave you for the rest of your day or night, whenever you're listening, to feeling grateful and happy. So the last question, what is one thing you're thankful for in this moment right now? Like, first thing that pops to mind, thankfulness.
My health.
Your health. Okay.
Honestly, not to like get too personal, and I don't care, anybody who's watching this knows this, but for anybody that does know me and has known me pretty much my entire life, I have Crohn's disease, and it's always a struggle to try to be the healthiest I can be. And right now I'm genuinely probably the healthiest I've ever been in my entire life. And it's a lot of trial and error, a lot of trying out different things, finding out what works for me, finding out what diet or whatever it may be works for me. Over the last several years, I've trialed a lot, and I feel like I've, found what works best for me. And so I am just very grateful for how healthy I am right now.
Yeah, that's something definitely not to take for granted. And it's easy to when you're just in the rhythm of health and feeling good, but you don't know what you don't have until you've maybe lost some of it. So I'm glad you're in a healthy place.
I know it's a little on the nose considering what like our profession and like what we're talking about, but yeah,
you're practicing what you preach.
Yes,
that's good. Well, thank you everyone for tuning in to the Clinic Concierge Collective, and we'll be back with another expert in this chair. We'll see you soon.